So I'd like to spend a few minutes talking about why this course is important for nurses to attend. Nurses are the people that are the links to our healthcare providers. We see patients more often in a hospital than a physician does or other providers do. They may come in and out of rooms, but we are there 24/7. And even in a clinic setting, the nurse is the one who rooms the patient, the nurse is the one who guides the patient. The patients may feel more comfortable talking to nurses about what's going on with them than with their providers. They may want to make their providers happy, and in doing so, they fail to give them all of information that's important. But patients are actually very happy to talk to nurses about how they feel, what's going on, what's wrong. And so by attending this course, it will help you to better understand things you need to think about in terms of taking care of patients with heart failure. It's important for us to have a broad understanding of heart failure assessment, heart failure epidemiology, heart failure pathophysiology, the different types of heart failure, for example. We need to understand how best to learn when our patients are getting worse, what to do about it, not just from a medication standpoint, but also from a self-care standpoint. And that generally involves the best diet, physical activity, and then doing things like getting your booster shots or coming into the office to be seen. So nurses are integral to heart failure management, and that's not going to change over time. If anything, it's going to become more important over time. And we need our nurses to really understand how best to communicate with patients and their families so that they can get the best care possible, and so that they'll want to come back in and continue to see us so that we can do our job of taking the best care of them. In the end, with everybody working as a team, we can improve the lives of our heart failure patients. We can improve their quality of life, their length of life, and we could reduce rehospitalization, which is no fun for everybody or for anybody. And so I'm hoping that this series of sessions will ultimately help you be better educated and allow you to then act on that education in the way you take care of patients.